Home should be a safe place for everybody, and every child should have a fair chance at life. This feels like common sense, and yet such rights are not possible for many Syracuse households who are disproportionately affected by lead. In one sense, it stems from a lack of screenings and testing, of knowledge around dangers of lead, and of clear resources to combat it. But as voiced by the community during this participatory budget process, it's so much more than testing. It's dilapidated housing stock. It's limited enforcement and repercussions for chronic code violators. It's the absence of coordination and transparency around policy. Perhaps most troubling, it's about a lack of equity and the overwhelming legacies of structural racism. In every sense, Syracuse faces a systemic crisis around lead that unequally affects Black, Latino, and New American residents living in some of the worst concentrated poverty in the nation. A holistic approach that uses testing as a first step for change is not just needed, it is required. Responding to the community's ideas, this project mobilizes CBOs and city residents for community-based campaigns and events. From them, we seek to increase screenings and testing, public education and awareness, and accountability among policymakers. First, Families for Lead Freedom Now will provide train-the-trainer education for at least 20 Peace Inc. and Syracuse Community Center Collaborative staff, as well as community members. From it, lead ambassadors will emerge that can advocate across all quadrants of the city. Once trained, an advocacy campaign will emerge that blends social media, community organizing, and awareness of connected anti-lead priorities such as housing, incarceration, and more. It will also connect the more than 1,000 households screened for lead by Peace Inc., the Life Needs Assessment, and other entities with testing, remediation, and treatment resources. Last, our partnership will host at least 6 testing, education, and advocacy events at Head Start and community resource centers. Ideally, a minimum of 100 children will be tested between the ages of 0 to 6. Testing will depend upon Onondaga County's ability to provide mobile screenings and/or a mobile testing bus. Regardless, these public events will educate and connect households to resources. And perhaps most importantly, the events will lift community voices to demand both accountability and change. The participatory budget process provided a blueprint for how an informed, activated citizenry can drive difficult conversations and advance reform around lead and more. We hope that our proposal heeds our community's calls and can live up to this blueprint. There is much to be done.